slowly the distance between two people is increasing, and then you decide mutually that it's not working out and you break up. So this is what happens here. The PR interval gradually increases until there is a skip beat where P wave is not followed by QRS. Yeah, so that is type 1. Type 2 is the one where you were not expecting it. The PR interval is completely normal and suddenly you find that there is a breakup. The boy shows up and says that there is a sudden skip beat, that this is not working out for me. And you realize that everything was okay, but suddenly a P wave is not followed by QRS, or sudden skip beat. Okay, so that is what the second degree models type 2. Third degree heart block is the one which is open relationship. Yeah, so this is what is AV dissociation. This is where both the partners know that it's not going to work out. So what happens is the atrium has decided to contract on its own, the ventricle has decided to contract on its own. So the P to P interval is constant, R to R interval is constant. Okay, so we can see that there is no relation between the two of them. P and R have nothing to do with one another, but the P to P distance is constant, R to R distance is constant, and this is what is AV dissociation, or a complete heart block. And then the last one where you see that it's an elderly patient. They'll give you in the history elderly patient. Look at this. Very, very irregular heart rate. So sometimes it takes so much time for the next beat to come. Sometimes it comes quickly. So this is what is sick sinus syndrome. Everything is in the name. The sinus is now sick. When it can beat, it will beat. When it can't beat, it will not beat. The only thing is PQRS is constant. A constant PR interval, everything else, every P wave is followed by QRS. So that's how you will not mix it up with other heart blocks. What to do? If the patient is unstable and symptomatic, that is only when you treat. Don't treat stable asymptomatic patients. So the first line drug is atropine, so you will